on TV, mga kasambahay, your ultimate guide to wellness and vitality. I'm your host, Dr. Barba-Cabodil, and I'm thrilled to be here with you today, bringing with you the latest insights and expert advice on achieving a healthier and happier life. Pero naku, bago po ang lahat, mga kasambahay, I would like to invite you to follow and subscribe our social media accounts. Please like and follow our Facebook page at www.facebook.com/DoctorsOnTV. And like and subscribe to our YouTube channel. Just type www.youtube.com/@UNTV News and Rescue. And you can actually send us questions and mga comments po sa pages na yan. Kaya naku, after liking and subscribing, i-share nyo na din po sa inyong family and mga friends. Narinig nyo na ba, mga kasangbahay, ang sinasabi ng ilan na ang psoriasis is just a dry skin? Yan ang mga katagang, naku, hindi po natin dapat paniwalaan dahil ang psoriasis po ay lifetime disease that requires a long-term treatment strategy. Naku, pero atin pong alamin, gaano na ba karami ang may mga ganito pong klase ng kondisyon? Let's watch only here at Dose of Information.
According to World Health Organization, psoriasis is a chronic and non-communicable skin disease that affects many individuals worldwide. The impact of this condition on people's lives can be immense, often causing negative effects. The prevalence of psoriasis varies across countries, ranging from 0.09% to 11.43%, with at least 100 million individuals affected worldwide, making it a significant public health concern.
Ayan, mga kasambahay, naku, para sa kaalaman po ng lahat, nabanggit kanina na non-communicable disease ang psoriasis. At ibig sabihin po nito ay mga uri ng sakit na hindi po nakakahawa. Patikim pa lang yan, mga kasambahay, naku, para sa ating tatalakayin mamaya. And for deeper understanding about this, stay tuned. Doctors on TV will be right back.
Psoriasis, a chronic autoimmune disorder that causes the rapid growth of skin cells, resulting in thick, scaly, and often itchy patches of skin.
At para mas maintindihan pa po natin lalo ang nakapaloob sa talakayan na ito, mga kasambahay, get ready to embark in a journey of understanding as we have invited a special guest joining us today, and who will give insights about psoriasis skin disease. Let us welcome Dr. Angeli Eloise Torres-Paulino, a dermatologist and a photomedicine specialist from the Makati Medical Center. Good morning, Doc Gail, and welcome to Doctors on TV.
Good morning, Dr. Sarah, and good morning to our kasangbahays. Thank you for having me today.
Yes, and now let's start, Doc Gail, with our discussion. No? As mentioned in our introduction a while ago, Doc Gail, why is it that psoriasis is called a chronic autoimmune skin disorder?
Okay, so when you say autoimmune, it means that the body's immune system is attacking itself. So in the case of psoriasis, the immune system is attacking the healthy skin cells, and this causes the new skin cells to form in a matter of days instead of the normal weeks to about a month. And because of this, nagkakaroon po ng build of the skin cells causing scaling and redness, which can sometimes be itchy and even painful for some patients.
So you mentioned there's piling up of new skin cells. So basically may pangangapal, tama, Doktora?
Yes, that's right.
I see. And ano po ba yung sanhi ng psoriasis? Kung kahit sino bang ordinary individual, pwede magkameron nito or merong some predisposing factors po involved?
So actually, anyone can have psoriasis, but there are factors that can increase the risk. So people who have family history or yung may mga kamag-anak na meron ding psoriasis, mas mataas ang chance that they will also have psoriasis. But it's more complex than that because we also see a lot of patients with psoriasis na wala namang family history. At the same time, may mga patients with family history who never develop psoriasis in their lifetime. Psoriasis cannot actually be attributed to just one cause. It's different factors combined. So we have our genetics and then the autoimmunity that we mentioned earlier. And then the other factor is environmental, which includes stress, cigarette smoking, consumption of alcoholic beverages, and infection or illness, and then trauma or trauma to the skin. So all of those factors combined can cause a person to have psoriasis.
I see. But in your practice, Doc Gail, ano po yung mga certain illnesses that can be associated or linked to psoriasis?
Oh, so there are a lot actually. In recent years, it's been advocated na ang psoriasis hindi lang siya sakit ng balat. It's actually a multi-systemic condition. One of the most common is arthritis. So many of our patients who have had psoriasis for a long period of time, they tend to develop arthritis or rheuma. Patients with psoriasis are also found to be at higher risk of having hypertension, diabetes, unhealthy cholesterol levels, or cardiovascular disease. They also tend to be of the obese side, which increases the risk of these conditions. And then we also have inflammatory bowel disease, even eye problems can be connected with psoriasis.
So, okay, marami pala talagang nakalink here. And kasi siguro you mentioned a while ago also that this is really multifactorial.
Yes.
And meron bang certain age, okay, mas prone ba dito mga bata or yung mga nasa middle age or even older individuals? Or sino po usually yung mas of higher risk in having psoriasis?
So actually, psoriasis can occur in any age and wala siyang pinipiling gender, so both males and females are equally affected. But based on statistics, we find that most patients would fall between the ages of 20 to 40 or 50 to 60 years old.
I see. Okay. And ito yung mga, yung sinabi mong age, ito din usually may mga comorbidities na, no, Doktora?
Yes,
Ibig sabihin po ng comorbidities na meron ng mga ibang mga illnesses, pre-existing illnesses. Okay? So, and that means mas mahirap i-manage if ever kasi marami na pa ibang conditions, may mga ibang gamot na rin na tinitake ang mga pasyenteng ito, no, Doktora?
Yes, that's true po. There's also findings po kasi na yung mga patients, so we mentioned that psoriasis increases the risk of these conditions. At the same time, if a person already has, for example, hypertension, diabetes, or high cholesterol, it's harder to control the psoriasis if those conditions are not controlled.
I see. Okay, so one thing affects the other. Parang
Yes.
ganun, and vice versa. So, okay, kanina na-mention natin, di ba, na parang itong psoriasis is actually an autoimmune skin disorder. So, basically, the immune system really plays a role, no, sa development or progression itong condition na ito. And what exactly is wrong with the immune system of individuals who have psoriasis?
Okay, so in psoriasis, the T cells, which are a kind of white blood cells that are responsible for helping us fight infection and illness, they become overactive. And because of that, they stimulate these proteins, mga protina, tawag sa kanila is cytokines, that are responsible for causing inflammation in the body. So lahat ng klaseng inflammation sa katawan or pamamaga, every time we have that, it means there are cytokines present. So because of that, nagkakaroon ng pamamaga sa balat, which would be yung typical skin lesions because bumibilis yung turnover ng skin. So under normal circumstances, nagta-turn over yung skin cells natin every 21 to 28 days. Pero sa mga may psoriasis, masyado siyang mabilis because of this overactivity, nagiging mga 3 to 7 days na lang. So nagpa-pile up yung skin cells causing the thick scaly lesions that are very typical of psoriasis.
I see, kaya nangangapal. Kasi
Yes.
parang they're like multiplying faster than normal.
Yes.
Okay, and ito ba, Doktora, may mga trigger factors ba to? Ibig sabihin, ano yung nagsistimulate dito sa mga T-cells na to kung kaya itong mga psoriasis nangyayari po itong mga pangangapal na to?
Yes, so actually there are a lot. Most of them are environmental po. So andun yung emotional stress, very, very common. We also have cigarette smoking, consumption of alcoholic beverages. Pagka nagkakaroon ng infection or sakit yung tao, some patients also report that changes in weather would trigger them. And certain medications. So these factors can cause a patient to have psoriasis for the first time. And sa mga patients who already have psoriasis, it can trigger them to have flare-ups of their condition.
I see. Okay, and kanina, bukod sa pangangapal, Doktora, ano pa yung napapansin natin? Ano yung mga signs po? Kaya may mga nararamdaman bang sintomas ba ang pasyente na may psoriasis? Ano po ang mga ito?
So yung mga makakapal na rashes na yun, for some patients, it can be itchy, it can be painful kasi sobrang dry, nagbibitak-bitak, nagsusugat, so masakit. Some patients will also notice na nagbabalakubak sila when they have these lesions on the scalp. And they can also have nail changes, parang nasisira yung mga kuko or nagdi-discolor. For patients who already have arthritis, they can even have joint pains.
I see. Okay, so talagang marami rin pala. So basically, head to toe pwedeng ma-involve.
Yes,
okay, sa
that's true.
psoriasis. And ito pong mga to, pag umatake ba to, pag nagkaroon ng atake, how long tumatagal itong mga manifestations po na ito?
So
bago magkaroon ng another attack?
Oh, okay. So it's really dependent on the patient. So very individualized shape, case-to-case basis. Depende rin yun if the patient has measures to control the attacks. Pagka kasi hindi siya na ma-manage or hindi nagagamot, may potential na lumala and it can even have other complications along with it.
I see. Okay. And are there like lifestyle factors that can worsen, okay, psoriasis, yung pwedeng pag may atake, mas lumalala kasi you mentioned about paglala, ano? Ano yung pwedeng mas mag-cause ng paglala in the event na may attack na po dito sa pasyente?
So the factors that can trigger a flare, actually halos sila din. But in terms of lifestyle, yung pagkakaroon ng sobrang bigat or obesity, it's a big factor because if you're obese, it also increases the risk of having hypertension, diabetes, unhealthy cholesterol levels, and cardiovascular disease. And we mentioned that those things can contribute to making psoriasis difficult to control. And then, of course, we have cigarette smoking and consumption of alcoholic beverages. Those are also factors that can worsen your psoriasis and emotional stress.
Nako, na-imagine natin kung ganong pwedeng maging debilitated ang isang pasyente tuwing meron siyang atake ng psoriasis. And, you know, how does psoriasis affect the quality of life ng pasyente?
This has been extensively studied actually because traditionally, akala kasi nila ang psoriasis sa balat lang. So, it was traditionally believed that it's just a cosmetic concern. But now, we know that it's much more than that. A lot of the impact that it has on the quality of life is because of how they are perceived. So, most of the time, these patients are stigmatized, pinandidirihan sila, iniiwasan sila because merong misconception na nakakahawa siya or that madumi sila kaya sila ganon. And then add to that yung pagka meron ng complications like arthritis, it can be physically debilitating for them also because if hindi na-address yung arthritis, it can lead to joint deformities and hindi na nare-reverse yun.
Nakakalungkot, no? Nga maraming minsan nadidiri talaga sa mga mga individuals na may atake ng psoriasis. Pero ito, no, naku, makasambahay, nire-reiterate po natin na hindi nakakahawa ang psoriasis. Kung ano po ang kailangan ng mga pasyente ay basically understanding dun sa condition o dun sa pinagdaraanan nila. And ito, Doktora, you mentioned about the joints. Are there any other organs po na affected also kapag may psoriasis ang isang individual?
So there are a lot actually, from head to toe. So of course, there's the mental health. Many of our patients with psoriasis, they tend to suffer from anxiety, depression. We've had reports of patients na nagkakaroon ng thoughts of committing suicide, which is really bad. And then it can also affect the eyes, yung tinatawag na uveitis. So some patients with psoriasis can have that as a complication. We also have inflammatory bowel disease, which is also an autoimmune condition. And then, of course, arthritis, which affects the joints, causing deformities. Patients can also have higher risk of having cardiovascular disease, liver and kidney problems, hypertension, diabetes. Maraming pwedeng maapektuhan.
So nakakalungkot talaga, no, pag merong ganito. And then, of course, kaya hindi mo mapipigilan or hindi mo maiiwasan kung ikaw ang pasyente na nagkaroon ka ng anxiety. Okay, and Doktora, is this a lifetime disease?
So, unfortunately, as of now, there is no cure for psoriasis. So, I would say yes, it is a lifetime disease. But the good news is, compared to maybe, let's say, even 5 or 10 years ago, the options that we have for psoriasis are very extensive already and they work very, very well. So there is hope for our patients. Marami nang pwedeng gawin. And these treatments that we have now, napakahusay na to the point that our psoriasis patients can be 100% clear. Yung mga possible complications or potential complications that go along with psoriasis can be addressed also by these medications.
Well, that's good news, ha? Diba? Parang kasi before, parang akala nila parang, okay, so this is the end point already. I will have to live with this for the rest of my life. Okay, so ito pala may brighter future when it comes to psoriasis. So, ang importante ay makita sila ng doktor para ma-diagnose right away. Okay, we know na pagka early diagnosis would mean early management as well, and hence prevention of complications. And ito, Doktora, how do we diagnose psoriasis? So clinical lang ba, or do you have ancillary measures rather that you request para po mas ma-confirm itong diagnosis?
So usually, pag ang pasyente is nagpe-present with the typical lesions, yung thick, red, scaly plaques in the typical areas which are yung mga parts of the body na madalas na to traumatize, like the elbows, the knees, the lower back, or the scalp, and then kapag meron din siya ng mga nail changes, typical of psoriasis, which is yung nangangapal and nagkakaroon ng pitting, yung mga parang tuldok-tuldok dun sa nails, then clear-cut na yun. Pwede na siyang ma-diagnose with psoriasis without doing anything else by a board-certified dermatologist. But if there is doubt, pag medyo hindi sure or hindi masyadong typical yung presentation, we can do skin punch biopsy. So we take a sample of the skin and then we send it to a dermatopathologist or a pathologist who reads skin biopsies to confirm that it is really psoriasis. And if there is doubt, I always do this because I always say that psoriasis is a life-altering condition. So I don't want to just give the diagnosis to a patient if I'm not sure. Gusto ko sure talaga. And syempre, kasi yung mga gamot, merong mga iniinom ng gamot that can have an effect on the immune system. So pagka ganun na hindi sure, I want to document it with a biopsy.
I see. And I know this may sound so technical, pero usually po ba, ano ang nakikita sa biopsy? Ano po yung histological feature of the skin biopsy of a patient with psoriasis?
So to simplify, sa normal na balat po kasi we have a typical na itsura na meron tayong several layers, yung ating stratum corneum and the other layers. So in psoriasis, basically what happens is nakikita natin na medyo, depende kung makapal na makapal yung lesion, syempre may nakikita nating makapal din yung top layer ng skin. And then, yung area in between the epidermis and the dermis, sa normal na skin, usually, parang smooth lang siya na parang wavy, ganon. But in psoriasis, nagiging exaggerated yung pagka-wavy na yun. We call that psoriasiform hyperplasia. Parang nag-elongate na siya. Nagkakaroon ng pagkanipis ng mga top parts na yun. Yung mga blood vessels under the skin, medyo lumalaki sila, nag-dilate. So that's the reason why pagka kinukutkot sometimes when we pick the lesions of psoriasis, nagdudugo siya.
Oh, okay. Yung pagkasabi niyo may pangangapal, di ba? Tapos pag nangangati ang pasyente, so hindi maiwasan kasi when there is dryness, there is itchiness. So, ang tendency ng pasyente, kutkutin. Kung kaya, may pagdudugo. And that's also apparent pag nakita sa skin biopsy, may mga parang bleeding na itsura. Okay.
Yes, so yung dilated na blood vessels under the skin.
Dilated blood vessels under the skin. Okay, and nakakatakot ba magpa-skin biopsy? Baka yun ang gustong malaman ng ating mga viewers, Doktora.
So no, hindi siya nakakatakot. It's actually a very minor procedure. Ginagawa lang siya sa doctor's clinic. So what we do is we take a tool called a skin punch. Parang it's like parang literal na puncher ng parang sa paper. It's really small. It's siguro usually the biggest we have is mga 4 millimeters lang.
Maliit lang.
Maliit lang siya. And yung pinaka parang blade ng punch tool, it's enough just to get the whole skin. So hindi naabot sa buto. Balat lang talaga yung kinukuha niya. And then,
anesthesia ba, Doktora, pinapahid?
Yes, it's under local anesthesia. So injected, yun na yung sakit na makakamdaman ng patient. It's very minor lang. And then it's a very quick procedure. We just take that sample, we send it to biopsy. It looks like parang siyang maliit na tadpole when it comes out. Super small lang.
I see. So
and then,
there's no...
it heals on its own like a regular wound. Most of the time, depending on the area, we don't even need to suture sometimes.
Okay, so hindi nakakatakot. Okay, so yun po pagka medyo may pag-aalinlangan. Kasi lalo na ngayon, di ba marami sa atin talagang mga nag-google and naku, ito ba ang sakit ko? Nagsiself-diagnose ng karamihan. And of course, syempre, mas ina-encourage natin ang ating mga viewers, of course, na maganda ma-diagnose tayo properly ng mga board-certified dermatologists. Naku, ito, marami na po tayong natututunan, mga kasambahay. Naku, at meron pa po tayong mga dapat abangan mamaya. Naku, pero pansamantala po muna natin ititigil ang ating talakayan. Kaya naku, huwag ililipatan channel. Doctors on TV, we'll be right back. At para pa rin po sa pagpapatuloy ng ating talakayan, kasama pa rin po natin si Dr. Angeli Eloise Torres-Paulino or Doc Gail, a dermatologist and photomedicine specialist from Makati Medical Center. And now, Doc Gail, for the continuity of our discussion, let's talk about prevention first, before we proceed to the treatment options. Eto, doktora, no, ito ba, ano ba yung pwedeng gawin ng pasyente? Sabi nyo nga kasi, di ba, it's multifactorial. So, hindi mo naman maaalis dun yung genetic predisposition or yung nga, yung chance na namana mo siya. Plus, of course, the interplay of the other factors that were mentioned a while ago. Okay? So, eto, pagdating ba sa pagkain, meron bang dapat iwasan yung mga pasyente na may psoriasis para iwasan din ang atake?
I get this question a lot from sa mga pasyente ko. The answer there is wala pa kasing food that's been proven to directly cause a psoriasis flare that can directly increase your risk of having psoriasis. What I usually say is because it's been shown that that psoriasis is associated with all these metabolic conditions like hypertension, cardiovascular disease, I think just maintaining a well-balanced diet, just to maintain an overall good health is enough to keep your psoriasis at bay. So, syempre, yung usual na wag masyadong madaming matatamis or mga matatabang pagkain, drinking in moderation, like 1 glass of wine for females or 2 for males in a day, just to maintain an overall good general health. Yun yung madalas kong tinuturo sa patients.
Okay. And sa mga pasyente niyo, doktora, kasi di ba may mga common signs like what you have just mentioned a while ago, no? Nangyayari rin po ba na, kumbaga initially, puro sa same spot. And then, sa susunod na mga atake, may mga other parts of the body which get involved already?
Okay, that's a good question, no? So, actually, for people who already have psoriasis, ang napapansin nila is when they get flare-ups, it always happens in the same spots. And that has something to do with their immunity. Ang nakita nila is merong role yung tinatawag na memory T cells sa pagkakaroon ng psoriasis. Kaya pag nagkakaroon sila ng flare-up, usually, it's always in the same spots. And we've seen this also with other conditions like eczema or vitiligo. Meron ding memory cells na nakasama dyan. Kaya every time they have a flare-up of their skin condition, ang tendency, it's always in the same spot. Of course, if hindi siya na-control sufficiently, may tendency na magkakaroon ka din ng bago in other areas eventually.
I see. Naku, ang ganda ng sagot mo, doktora. That's really interesting to know, no? Na talagang because of that memory cells that we have, okay, so nagkakaroon ng predisposition sa same spot. And then sabi nyo nga, pag hindi na-control, that's when pwedeng magkaroon ng involvement ng other areas.
Yes.
That's the reason why I asked that, kasi this leads me to this next question na paano mape-prevent, okay, though you mentioned a while ago na dapat nako-control kasi, pero meron ba kayong ibang inputs para ma-prevent po yung spread ng psoriasis, I mean spread to other organ involvement or other skin tissue involvement?
Yes, so actually, the key there is to intervene early. As soon as na-notice mo na parang nagkaka-flare up ka, if you already have psoriasis, or if you see a skin lesion that you suspect might be psoriasis and you're not sure, better to see your board-certified dermatologist to get a confirmation because that's really the best way to prevent it from spreading is to treat it early.
Okay, so kaya talagang dapat talaga early diagnosis para magkaroon ng early management. Okay, and paano po ginagamot or minamanage ang psoriasis?
So we have different options now, no? Like I mentioned earlier, compared to maybe even 5 or 10 years ago, ang dami na talaga. So in general, there are 4 kinds of treatments that we offer our psoriasis patients. We have our topicals, yung mga creams and ointments. We also have oral medications, mga tablets. And then we have phototherapy or yung UV therapy or yung iba tawag na doon yung pailaw. And then the last one, which is the newest one, is yung biologics or yung mga injectable medications. So in most cases, especially if medyo extensive na yung mga skin lesions, we combine the different kinds of treatment para mas optimized yung effectiveness niya.
I see. Okay, so you mentioned about yung kanina yung topical or yung pinapahid. Ano pong klaseng mga gamot itong pinapapahid natin sa patients?
So most of the time, ang pinaka-first line dyan is yung mga topical steroids, like yung mga clobetasol or mometasone. These are anti-inflammatory na mga ointments or creams that are meant to lessen the redness and the thickness of yung mga lesions natin sa balat. We also have preparations that are ideal for the scalp, yung mga scalp solution. And I think now we even have steroid preparations in a shampoo form. So targeted for patients na mayroong mga lesions sa scalp. So what I do want to emphasize with these steroids is sometimes kasi patients, when they get the treatment and they find it's getting better, they just apply it indefinitely. Pero hindi po tama yun, ha? When you're prescribed a topical steroid, importante na may monitoring ng doctor nyo or ng dermatologist nyo because these also have side effects. Tulad ng mga ibang gamot, may side effects din yan. If masyadong matagal gumagamit ng steroids nang hindi na mo monitor, it can potentially cause thinning of the skin, nakakanimbis siya ng balat. So magkakaroon ng mapuputing patsa dun sa parts na laging pina-applyan ng steroid. Yung iba nagkaka-stretch marks dahil dun sa pagkatipis ng balat. So very important na under the supervision of your doctor, yung paggagamot.
Yeah, dapat natin i-emphasize also dito sa ating mga viewers na even though that this is a topical form, sabihin yung pinapahid, they get absorbed by the body, So basically, and we do not want really prolonged exposure to steroids. Okay, ang steroids talaga, pag properly given, na ma-maximize natin yung benefits. But of course, this comes with side effects po, mga kasambahay. Naku, huwag natin kakalimutan yan. And how about the oral form? I mean, you mentioned about the oral management of psoriasis, Doctora.
So for the oral form, usually we recommend this for patients na medyo madami na yung lesions nila o yung hindi lang naka-confine in one area, and also for patients who already have arthritis because the most common that we give is yung tinatawag na methotrexate. It's a DMARD, disease-modifying anti-rheumatic drug. Originally, gamot to sa rheumatoid arthritis, but they found na it also works really well for psoriasis. Matagal na tong gamot na to. Siguro it's been in use for that purpose, for psoriasis for maybe about 50 years na, if not more.
Na.
So this is really ideal for patients who already have signs of arthritis with psoriasis or yung medyo madami na yung mga lesions nila. And then, andun din we can also give mga antihistamines for those who have itchiness. Meron pa yung cyclosporine, which is a type of immunosuppressant for patients who don't have satisfactory response to the other treatments. Actually, abroad, there are other oral options also that are not available here.
There's a lot pala talaga, Doktora. Yes. And I just want to ask, para dun sa ating mga curious na mga pasyente pong may psoriasis with joint involvements already, itong mga oral na to, like for example, the methotrexate, ibinibigay din ano tuwing atake lang po to ibinibigay? Or is this something that has to be maintained to prevent attack as well?
So, it's actually something that's meant to be maintained. But again, just like your steroids, may side effects din siya. So, the goal really is to maintain the condition with as little medicine as possible. So, pwedeng sa simula, medyo madami, maraming iinumin, maraming ipapahid. Then later on, pag na-achieve na natin yung control na gusto natin or satisfied na tayo sa control na nakuha natin, we can slowly lessen yung mga iniinom or yung mga pinapahid.
So, napaka-importante talaga na may nagmamanage na doktor and you do not self-medicate.
Yes.
Okay, so para kumbaga iti-trim down yung dosing and the rest. Okay. And ito, Doktora, you mentioned also about phototherapy, may pailaw. So, can you explain this further?
So, phototherapy is basically what it is we use UV light to treat skin conditions. So, this hindi lang sa psoriasis to, maraming skin conditions na nagagamot ng phototherapy, but psoriasis is the most common kasi it's what it was traditionally used for talaga. So, basically, ang mangyayari dyan is the patient will go to a phototherapy center or to a hospital that has a phototherapy facility. Kailangan to ginagawa ng 2 to 3 times a week, so there's a bit of a time commitment. The most of the time, the machines look like para silang cabinet na puro ilaw. Ang lagi kong example na binibigay sa patients is if you're familiar with yung mga baby sa NICU na iniilawan, parang ganun din siya actually. It's actually like that, except that you're standing up, you're in a booth, na puro ilaw all around. Each treatment session would last maybe less than 5 minutes. And then you do that 2 to 3 times a week. Every time you come, mas magiging mataas na yung dose ng UV. So medyo slightly longer na yung time mo inside the machine. And then because it's ultraviolet, similar to the ultraviolet that we have in natural sunlight, many of the side effects na pwedeng ma-experience ng patient is similar to what you would feel if medyo naarawan ka ng masyadong matagal or na-sunburn ka.
I see. And Doktora, para lang ma-educate natin yung ating mga viewers, no, anong klaseng ilaw to? Meron ba tong certain wavelength or what? Kasi baka akala nila, sa bahay maglalagay na lang ako ng ilaw. So, di ba meron pong mga certain wavelength, yun po yung mga nanometers na units ng ilaw, di ba? So, para at least alam nila, this is no ordinary light, okay? So, at yun ang kailangan for that particular condition.
Yes. So, actually, the wavelength na ginagamit sa phototherapy is narrowband ultraviolet B. So, very specific siya. Between 290 to 320 nanometers yung ultraviolet B. And then, it's narrowband pa. So, medyo specific talaga siya for psoriasis. So, I think sa mga sa mga provinces or in areas na walang access to these machines, naging parang fallback nila is magpapaaraw ng natural sunlight. While that's, technically, that can work. But the thing is, yung natural sunlight kasi, hindi lang siya ultraviolet B. So, marami kasing kasama yan. May ultraviolet A, may ultraviolet B, ultraviolet C, which we don't really experience here because nabablock siya ng ozone layer. Pero yung natural sun kasi na nakukuha natin, mas majority ultraviolet A siya eh.
Although, not so much of the B, which actually ang kailangan for the psoriasis cases.
Yeah, so, but I mean, technically, ultraviolet A we can also use. But in terms of effectiveness, side effect profile, tsaka yung tolerability sa patient, they found na ultraviolet B works better. But we do have patients also in the center who do ultraviolet A. So yun yung mga hindi na nag-respond sufficiently to the ultraviolet B.
I see. And this phototherapy is being done every time may attack po, or is this something that has to be maintained as well?
So, just like your orals and topical medications, this is something na long-term. So, I emphasize this na kasi syempre, it would require the patient to go 2 to 3 times a week to the center. So, medyo long-term siya. It's not something you do a few sessions of and then you're done. So, just like the orals and topicals, initially, you will go through regular phototherapy sessions 2 to 3 times a week. And then, usually, once na-achieve na yung control ng lesions na happy ka na or happy na si doctor, or clear na talaga, we don't immediately take it out. Usually, tinitaper off siya. So, instead of maybe coming in 2 to 3 times a week, once a week na lang.
I see.
And then later on, once every 2 weeks, and then once a month.
So, there's really close monitoring when it comes to management of psoriasis, Doktora. And what happens if you leave psoriasis untreated? Okay, though, medyo na tayong mga na pag-uusapan na pwede mas madagdagan yung ibang part involvement, okay, when it comes sa body. Ano pa yung iba pwede mangyari pag sinabi nila, hindi naman ang daming gagawin, parang ayoko nang ipatit, what will happen?
Yeah, so that's where I emphasize that psoriasis is not just a skin condition, it's multi-systemic. Because aside from yung potential for the skin lesions to spread, of course, the potential to develop the associated conditions, tumataas din kasi hindi siya nakokontrol. So, for all psoriasis patients, regardless of how extensive or how localized yung mga lesions nila, all of them, they have a risk of developing arthritis. So, that's something na continuously minomonitor ng doctor. And then, there's also a risk of developing yung mga other conditions like inflammatory bowel disease, metabolic disorders, yung eye problems. So, it's really important na that when you do have psoriasis, that you partner up with a board-certified dermatologist to manage the condition.
I see. And pwede ba tayo magbigay ng additional self-care measures to better manage psoriasis para din sa ating mga kasambay, especially that, di ba yung iba parang, of course, budget-wise, marami din kasi naging challenging din ang ating mga kababayan, of course, especially itong pandemic, though we're not done with that yet, no? But of course, ang daming nawala ng work at napakaraming challenges, and syempre, financial challenge would be one as well, no? Ano yung pwede nilang, para makabawas sa kanilang expenditure to manage psoriasis? Ano po yung pwede nilang magawa to prevent attacks, or once there is an attack, at least prevent yung progression of severity?
So, the key there really is to intervene early nga. So, early detection and treatment. So, as soon as you notice na may kahit ano kayo sa balat, better to consult your doctor just to make sure that na makuha nyo yung tamang treatment for that. So, with regards to psoriasis, because it is a lifetime condition, syempre yung financial aspect, it's an issue, especially in our setting, kasi they have medications that they would have to be on for a long period of time. But the good news is, ang mga patients natin na may psoriasis, they can actually apply for PWD. Right now, yung National Psoriasis parang support group natin, which is yung SORFIL, they're working on making psoriasis its own category under PWD. Kasi right now, yung mga patients natin na may psoriasis, when they apply, they would either fall under psychosocial or physical if they already have arthritis. As of now, nag-grant naman siya. But SORFIL is working on making psoriasis its own category under PWD. So, ano din yun? Makaka-menos gastos din kayo.
That's such a big help,
yes,
diba?
may PWD application naman. The key really is to intervene early because syempre, if medyo extensive na, medyo mas magastos din dahil mas marami ng gamot na kailangan.
Okay, so dapat talaga early on ma-manage. Okay, and Doktora, with that, namin natin natutunan sa inyo, ha? Ano pa po yung mga ibang final words niyo that you can share with our audience o sa ating mga kasangbahay?
Very short and sweet lang po. So this is something that I've read. I always advocate that psoriasis is not contagious, but awareness is. Ayan. So that's really a cause that's near and dear to my heart. I'm surprised that until now kasi not many people are aware that this is not a contagious condition. May nasistigmatize pa rin yung mga pasyente natin. But that shouldn't be the case. So to our patients, remember, you have to be your own advocate as well. So it's really important to educate yourself and your loved ones para naman ma-spread din nila yung awareness.
Oh, that's such a lovely and compassionate advice, okay, na naibigay niyo sa ating mga pasyente or sa ating mga viewers. And with that, Doktora, thank you very much. Thank you, Doktora. And we appreciate your all your inputs, okay, that you have shared with our audience, sa ating mga kasambahay. Ayun, okay, thank you very much again, Doktora. And ito ba kami final words kayo sa ating mga viewers? And you might want to invite them to visit you here at Makati Med.
So, good morning to our kasangbahays. Thank you again, Dr. Sarah, for having me. So, to end this, I just want to say that you have to be your own advocate. If you or your loved one is suspected to have psoriasis or other skin conditions, just see a board-certified dermatologist. We have a roster of excellent specialists here in Makati Medical Center, and we have a well-equipped phototherapy center.
We hope mga kasambahay ay marami po kayong natutunan sa ating talakayan with Dr. Angeli Eloise Torres-Paulino from Makati Medical Center. For some reasons, there are certain herbals which can help reduce skin inflammation. So without further ado, let's dive into 3 herbal treatments that support psoriasis to achieve relief of their symptoms. Only here at Naturally Yours.
Good morning mga kasambahay. Today, ating pag-uusapan ang tungkol sa isang autoimmune disease, ang psoriasis. At maraming misconception ukol sa skin problem na ito, kung saan marami ang nagsasabi na ito ay nakakahawa. Pero ang totoo mga kasangbahay, hindi ito nakakahawa, kaya hindi natin dapat nilalayuan ang mga taong may psoriasis. At para naman sa mga kasangbahay natin na may psoriasis, alam nyo ba na maraming natural way para ma-prevent ang paglala nito? Tara, pag-usapan natin. Alam nyo ba mga kasangbahay na ang aloe vera ay maganda para sa taong may psoriasis? Kuhanin lamang natin ang katas nito at lagyan ng konting dinikdik na bawang upang maging mas epektibo ito panlaban sa kati at pagkalat ng psoriasis. Isa pa mga kasangbahay, ang grapefruit extract, ito po ay ginagamit ng panglunas noon pa man sa traditional Chinese medicine. Dahil merong itong scientific research na nagpapahilom ng pamumula ng psoriasis, pagkalat ng kati at pagkasira ng balat. Ang isa pang makatutulong upang maibsan ang kati at pagkalat ng psoriasis ay ang indigo naturalis. Ang indigo naturalis ay isang uri ng herbs commonly used in traditional medicine for the treatment of psoriasis. Madalas itong ginagawang ointment para ipahid sa psoriasis upang mawala ang pangangati nito. Ayan mga kasangbahay, sana ay nasundan ninyo ang mga procedures kung paano makokontrol ang pagkalat ng psoriasis. At sana rin ay marami kayong natutunan sa episode natin ngayong araw. See you again next week for more natural tips. Muli, ako si Jason Sanchez, your integrative medicine doctor. Please follow me on my social media accounts, DocJTV. Because natural is beautiful, only here at Naturally Yours.
And that brings us to the end of today's enlightening episode. But before we say goodbye, I would like to greet Iyo and Iya and congrats sa inyong dalawa for Iya for being the valedictorian and sa inyong dalawa for having that Amafi Awards. Congratulations. And of course, EJ, hello, and sa ating mga pasyente po sa Klinika Figura. And as we wrap up today's episode, we'd like to extend our gratitude to all our viewers for their continued support. We hope you found this discussion informative, empowering, and inspiring. Remember to follow us on social media for updates. Don't forget to tune in next time, God willing. Muli po, maraming salamat po sa inyong lahat. Ito po si Dr. Sara Barba-Cabodil. Let's make it a habit to learn about good health. Only here at Doctors on TV.
Watch these snippets for the upcoming episode on Sunday.
Bypass surgery is not for all. It has to be a very strict subset of patients to improve its success rate.
We would like to thank Makati Medical Center, a hospital with a heart, located at Amarsolo Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor Ayala North Exchange Tower 1, Legazpi Village, Makati City. Mestiza soaps. Mestiza soaps are made with natural ingredients and a combination of vegetable and fruit extracts, which can be also used by children and pregnant women. Good news is that these beauty products are vegan and cruelty-free. For inquiries and orders, contact 0969-175-4231-33 or 02-8824-5217 or 02-881-30320. Organic Acai. Support your health with a 100% organic superfood supplement, Organic Acai Premium Blend, and Acai freeze-dried capsules. Rich in powerful antioxidants, fiber, amino acids, vitamin C, omega fats, and other essential nutrients the body needs to help build stronger immunity against illnesses and help increase your energy. Organic Acai is available in all Mercury drugstores and other leading drugstores and supermarkets nationwide. Linden Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgcsalesco@gmail.com. And of course, salamat sa ating partner, ang DepEd Santa Rosa, sa pakikiisa sa ating adhikain na maibahagi ang kaalamang pangkalusugan. Klinika Figura. You may contact them at 0917-317-7272. Medical Depot. Healthy Nom Nom Food. Barba-Cabodil Holistic Health Group, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Please like and follow Facebook page, Dr. Sara Barba-Cabodil. Special thanks to Dr. Gia Grace B. Sison, Head of Makati Med Wellness Center. Attorney Pilar Nenuga P. Almira, President and CEO. Dr. Saturnino P. Javier, Medical Director. Ms. Arlene L. Sonco, Senior Vice President. Ms. Monica Reyes Dizon, Assistant Vice President. Mr. Mark Funelas, Unit Head Manager, Communications and Special Projects.